Hello and good morning. I'm Barbry McGann, Executive Director, Office of the CHRO for Workday, responsible for working with our amazing customers to bring new solutions to market. And because before we get started, I want to cover the safe harbor statement because I will be looking at future-looking statements. But what I'm excited about is to talk to you about our latest solution, Vinnie, and that's our vaccine management solution that we announced on January 14th. And basically the whole goal and mission of our vaccine management solution is to help our customers create healthier workforces and safer workplaces. And basically this is an extension of our return to workplace solution that we announced last year, in which we've had tremendous amount of customers contributing to our solution. What we've really done here is we are now adding immunization data into Workday and delivering three key components. The first is a control center. So this is built on top of our Prism analytics. We're able to bring that vaccine management data, the availability, all the publicly available information on immunizations through CDC or the World Health Organization, and blend that with worker data so that we can help organizations really manage the health and risk of their workforce and their workplaces across their global organization. So that's first and foremost. Then, of course, the second piece of our solution is with that insight that they now have, they're able to use that information to do a couple of things. The first is really help look at the preferences and demand of their workforce for vaccines, and then prioritize and plan who gets the vaccines and the healthcare and benefits they need to provide to their organization based on that demand. But they also can use that information to help them figure out who can return to the workplace safely, who's eligible, and what risks are there across their organization at different workplace locations. And then the third component is really how to use that information to curate and create very tailored and personalized support and information for their employees, no matter where they are, based on their immunity status that they've self-reported or self-disclosed. So people that haven't had the vaccine yet, helping them get the resources and information they need to find vaccines. And for those that are afraid of vaccine, get more information and maybe resources to help them understand the benefits of vaccine. So those are the three major components of the vaccine management solution. Now the opportunity is quite large. Again, what happened is we work really closely with our customers. They brought to us a real need around vaccine management. It really started with our healthcare organization, where they needed to really manage and plan and monitor their essential workers and making sure that they had the vaccine. What we're finding, and from many surveys out there, but this is a Gartner survey, is that 60% of all organizations are encouraging employees to get vaccinations, but they will not require it. And we're also seeing that 60% of organizations are also planning to support and provide the healthcare benefits around immunizations. Now, in working with our customers, and this has been the huge demand, we just had a webinar last week, Vinnie, just to give you an idea of how important this is for our customers and how top of mind. We had record attendance. We set a new record for Workday in the largest number of registrants ever to attend a webinar for the vaccine management solution. So you can see that this is really top of mind for CHROs and our customers. And working with our customers, we really wanted to understand what were the capabilities that they were looking for. And it really encompasses these five key components. One is really how do they, with this large distributed organization that they have today, provide the resources and information to help employees understand where and how they can get the vaccine. So really having the ability to roll out quickly communication campaigns to help educate, provide learning in a distributed fashion, being able to put in place new benefits, policies, and programs to subsidize the cost of vaccines. Some of our organizations are actually facilitating and administering the vaccines to their employees and opening up health clinics, and then helping prioritize in the case that they are rolling out vaccines and administering that, who should get those vaccines first based on essential worker status, age, etc. So those are the kind of areas that we were looking to create a comprehensive solution around. And then with that, you can kind of see these are the key components of our vaccine management solution, really helping organizations evaluate not just their workforce, but their workplace for health and safety, provide them with the planning capabilities to not only prioritize the vaccines, but also who can return to work, who's eligible, to managing and communicating the vaccine management policies and programs to employees based on their preferences and interests, and then, of course, supporting their employees through this time.
Barbry, are you interfacing with the public health organizations in terms of availability? I mean, the first rollout has been fairly chaotic, right?
Right.
Now, it's been aimed at 65 and above, so probably doesn't affect many of your customers yet. But, like in Florida, poor senior citizens have had to stay on the computer for 4 or 5 hours to get an appointment, right? It's just been chaotic.
Yeah. So
as we move into, the 20s, the 30s, the 40s, the supply will still be lower than the demand, right? Would you be able to connect them with what's available?
So what we're doing is bringing that publicly available information about where vaccines are available, the supply of vaccines, and who has been immunized, bringing that data in and blending that with our workforce and workplace data to help HR leaders and business leaders help equip and inform their employees of where they can get vaccines. Now, in some cases, organizations are also planning to provide healthcare clinics that help their workers get those vaccines, but we're not directly interfacing, more like we're consuming publicly available information to help organizations with that process.
Okay.
Now, if we dig into our solution, it really does break down into 3 key components: analytics, planning, and when we talk about our human capital management solution, it's everything from our core HR to our benefits and comp to our employee experience with journeys and help to support that. And what I wanted to show here, this is our broader, what we call return to workplace solution. And what you can see here in orange is all the new capabilities that we've added to support vaccine management. So, how we're able to bring that immunization information into the control center. So now we can cover the whole community demographics and look at the overall health of your workforce and safety of your workplace. To over on the right, how we help that information in the planning scenarios that we talked about earlier. To at the very bottom, how we bring it in to help support the engagement and well-being of the workforce and what we call the reinvent area, and provide very specific curated journeys based on their immunity status. So we'd only provide vaccine information to those that would want to hear about the vaccines, and then make sure that we bring that information to ensure that we're safely reopening workplaces and returning workers back. And then if we dig in a little bit more, we'll go into each key piece. So in the analytics, this is just a view of what the Vaccine Command Center dashboard would look like, where we're able to see, based on self-reported, self-disclosed information, what is the status of immunizations across the workforce, even down to have they gotten both rounds of the vaccine. And of course, this is all information that would be self-reported by employees. We also provide the ability to do compliance reporting and adherence. Have they gotten both of the vaccines, and what does that look at by location? In addition to that, how we're getting the information on immunizations is we've expanded our health attestation survey as part of our return to work to now provide the capability to allow employees to also include their immunization status. Have they been immunized? What was the type of immunization they had? Have they gotten both rounds? They can even provide documentation here. And of course, this information then can feed into, are they eligible to return back to work, and then being able to monitor the health and safety of the workforce across the organization. Here, you're also being able to see a vaccine management dashboard so that we can kind of look at the status and also the preferences, because not everyone wants to get a vaccine. And so we want to be able to look at who is willing to have it, what is the demand for that, and that feeds into our planning of which healthcare benefits do we need to roll out, and then how do we tailor the journeys and experience around that. Now, with all that insight, of course, we're going to talk about the planning. So here is our planning model that takes this information. So based on the immunity demographics and preferences of people returning to work and who is eligible, and the capacity of the buildings to support all the social distancing and has the right level of PPE levels, we're able to kind of create a wave scenario planning of who can return to work and when they can turn to work and how to reopen work locations. We can also use this information to prioritize based on the demand and preference of those who want to get vaccines, and based on their status, their age, and so forth, how to prioritize the administration and rollout of their vaccines. And then with that insight, we're also able to really curate and tailor the outreach and communications. Again, going back to what we know about the employee, all the rich context that we have, their preferences for wanting to return to work, their preferences around immunization, their status, we can really tailor the content and the types of content to create very specific journeys to help them wherever they are along that journey. So if they want to get more information about immunizations, or if they've already been immunized, when are they going to be safe to return back to work, and what are the policies around that? So really leveraging that rich context to create those communications and provide education. I think there's a lot of unknowns around immunization, so making sure that they have all the information about the benefits of immunizations, and then being able to also provide a guided path. So if you're interested, here's where you can find vaccine availability, here's the benefits of it, here's how you can schedule the appointment. So really kind of tailoring this experience very specifically to the needs of the employee. And, here's more around the learning content, and then also being able to provide rich knowledge management and resources to really support them no matter where they are, get the help and support that they need. And also, in the case that they have gotten COVID-19, or they've had an adverse reaction to the vaccine, the ability to confidentially report and create a case that we can manage and help get to resolution quickly to ensure the healthy and safe workplace for the worker. So really, all of this was working very closely with our customers. That's the great part of my job, Vinnie, is I get to work with our amazing customers, really understand what they're trying to do, and then bring our large portfolio of products and its capabilities together to really deliver unique solutions for them. So here's just some examples of some of our customers that we've been working with that are using our control center to track vaccine availability and the status of their workforce, and then using this information to prioritize who gets the vaccine. So this is one healthcare customer. And then, of course, we have a high-tech customer that is really using this information to really tailor the outreach information and support that they want to provide to employees using our journeys and our help. And so with that, that's what I had to cover today for you, Vinnie.
A couple of things as you were talking about the learning area. That could be fascinating for people, right? To understand what's an mRNA vaccine, what are other ones, and what's happening with the mutations. How does that affect me? It could be a fascinating learning center. And,
absolutely.
And the second thing, tactical thing I was thinking about is I've seen people who've been vaccinated and they get handwritten cards. Since you're getting this digitally recorded now, maybe you can issue people a polycarbonate ID.
Yeah, that's a good point. One of the things I didn't mention going through this so quickly is that we also have a back to work passport. So this information based on the immunization status is now also part of the back to work passport, which is available on the mobile device and is used to also help check eligibility in returning to the workplace. So very much along those lines, Vinnie.
Great. And so the initial uptake's been, you said the webinar was very popular, but the early adopters
We're seeing tremendous demand. I think our biggest, it's a good problem to have, is how do we equip and provide enough services and support to get them live on this new functionality. So overwhelming demand. Like I said, I think it was over 1,900 people registered for the webinar. And, I would say about 1,400 actually attended. And so almost every day I'm talking to a customer about this new capability and helping them with understanding the capabilities that they already have with the products that they already own.
Fantastic.